Welcome back. We are talking about men's health. This Sunday is International Men's Health Day. So joining us now is APRN and board certified nurse practitioner Nick DeSorbo from DeSorbo Health and Wellness in Glastonbury. Thanks for being with us.
Thank you for having me again.
Now, this is a really important subject. We all know that we have to go to the doctors. A lot of us put those appointments off, but especially men, I find, and I hear from a lot of people that really men are the ones putting off those critical appointments. Why is that? What are the barriers standing in front of that?
You know, I think one of the key barriers that we're seeing today is that there's just a really high lack of access to those primary care services. So that first line access of where you can get your health and wellness kind of evaluated in that preventative nature is really being kind of pushed off because there's just such an overwhelming need for it at this time.
Yeah, and it really is where everything starts because from that primary care physician or provider, then you might find out that you need to see an expert or see a specialist. But the problem is, and I've experienced this myself, it's so hard to find a primary care provider these days.
Yeah, absolutely. I think that there's a few different factors, right? One, there's just such an overwhelming need that all of the providers out there are just overwhelmed. Their schedules are full, they're busy every single day, and it's so hard to find space available for a lot of these patients. And so that's how come the direct primary care avenue that I practice in really is of great benefit to a lot of folks.
And how are the other ways that you're trying to break down those barriers?
Yeah, so a lot of the ways that we break down barriers is we're providing access. So in providing access, we're providing appointments to patients in a very quick turnaround, 24, 48 hours. We use a variety of different methods too. So telehealth, phone calls, things that in your just traditional fee-for-service model is very difficult to obtain. So providing that access, building that relationship with our patients really gives them that ability to come in, be seen, really express their concerns and get the care that they need.
And it's interesting, you're talking about the access, and I think that's what the problem is, the main barrier is that people think that they only see their provider, primary care provider, once a year. Maybe they don't feel like comfortable or they don't feel able to speak to them when they really want to.
Yeah, absolutely. I think that kind of the trends in men's health recently, we're seeing a lot more prostate cancer, testicular cancer, more mental health challenges that are really putting up a fight for men to really get that care. And so breaking down that access, providing that relationship is critical in the preventative world, because how else are you going to be comfortable to say to somebody, hey, listen, I'm having a problem. What can I do? Can you help me?
Right. And so talk a little bit more about how the program works, how it works.
Yeah, so the direct primary care model is a low monthly membership service. So within that membership price, you get total access, every care that you need, every visit, everything that goes on.
So you don't have limits to the number of visits per month or anything like that?
No, whether it's once, 30.
So if you're a hypochondriac, you're going to call every day, and they're going to see you every day?
Yeah, they can talk to somebody in the office, they can talk to me, they can talk to to one of my only office staff members, so that way they know who they're speaking to.
Yeah, well, that really does give people a peace of mind that they're really looking for.
Yeah, absolutely.
Because there's something about that relationship with your physician, with your provider, that seems to be missing.
Yeah, it's hard. Right now the national average face time that patients get with their providers is about 7.5 minutes.
Right, one time a year.
One time a year.
Right.
Right. And then outside of that, you're being forced into urgent care settings with providers who don't necessarily know you. You're not comfortable. In our model, you see one person, you talk to one other person, so you really can build that relationship that is key to getting those preventative services taken care of.
Yeah, I mean, it's sort of a newer concept, but it sort of takes us back to almost like the country doctor sort of model, where everybody knows the doctor knows everybody.
Yeah, absolutely.
And your history.
Yeah, absolutely. It's really about building that community relationship, supporting the patients when they need it, and really being there for them. It's providing an extra level of customer service, patient service that you just can't get in today's healthcare industry.
All right, well, Nick DeSorbo, thanks so much for being with us.
Thank you for having me.
Appreciate your time.